So we now turn to a completely different type of network based here in Finland, and my great pleasure to invite Tomi Mäkelä to come and tell us about it. Thanks, Tomi.
Thank you. Yes, thank you very much for the opportunity to tell a little bit about a local national cancer network, which we call FICAN. I first have a disclaimer to make, which is that this network is at the step 1 of OACI involvement, which is membership application. And on Friday we have a General Assembly grilling, and as you can see, I'm pretty nervous about it because I have the General Assembly still here on the slide. So with this, I hope that I don't flunk it at this presentation and get a disapproval on Friday. So I'm a researcher, a translational researcher by background, and throughout my career I've been a huge proponent of peer review. And therefore, OACI represents really an admirable organization to me, and I think it's wonderful that you are here in Helsinki, and thanks for the HUS Comprehensive Cancer Center for organizing the meeting. So with that, let's see if I can figure out the slide. So what is FICAN about? The Finnish Cancer Center, FICAN, the mission is to enable tomorrow's cancer care in Finland. It was established a couple of now 7 years ago, and it's a network of 5 regional centers with a coordinating unit, very much like Simon's outline of networks. And the stakeholders are all the Finnish healthcare providers, which is a total of 18, as well as medical universities, which are 5 in number and organized in the same way. The mandate for FICAN comes from a legal decree, which is to plan and align national activities broadly, from all the way from prevention to rehabilitation. And also at the same time to ensure a strong research base. So in this way it fulfills the integration of care and research. The way it works is that it is coordinating both regional and national activities. So this is the way it's organized as 5 regional centers and the national as a single national center. And the organization chart, because of this, is slightly complex, so that there's a national board which is represented by all 5 regions. In addition, there are 5 regional boards which are then coordinating activities regionally. Yes, so how does FICAN compare to the OACI centers in Finland? So first of all, as you heard, Finland has been remarkably active in OACI accreditation, and that is, I think, the kickoff of this was accreditation of the HUS Comprehensive Cancer Center already in 2014, and this has led to accreditation of all the centers except the Oulu University Cancer Center, where the accreditation process is still ongoing. As you can see, the regional centers of the cancer center are aligned with the OACI centers, and therefore there's a good question, I think, to be made of what is the relationship between the accreditation process of OACI and the nationally legally mandated FICAN Cancer Center. So what has the national network provided in added value? I think that many of these are areas where the Cancer Center has been facilitating activities nationally, and this includes planning and guidance of screening programs, so this goes to the prevention part, and all of these activities are at the responsibility of one or more of the regional cancer centers. Also coordinating guidelines, which of course has been active already before that, but there's been both kind of a more active participation in guidelines and also taking care that they are frequently updated. Here's two examples of very recently published colorectal guideline. Also taking part in implementation of the European Beating Cancer Plan and Mission Cancer, where I'm especially interested. I was on the Cancer Mission Board when the plan was written up, and I think that many of these projects in which one or more of the OECI centers or the regional centers are participating is very nice. I think that we as a country should be even more active in several of the projects, and hope that this is going to be increasing in the upcoming calls, which are now open and Simon already mentioned. And also in taking research projects to a national level, and this has been especially active in precision cancer medicine, where there's been a number of projects which have been implemented nationally. Three of these are mentioned. A Cancer IO project was looking at uptake of IO treatments in cancer care. The FinProve trial is one of the drug repurposing trials, which is international collaboration, whose Comprehensive Cancer Center is responsible for. FICAN is a national research and development flagship, where I'm spending quite a bit of time in, which has some elements, as you heard, from the Irish Biobank project, where we are collecting a large biobank of samples and comparing this with real-world data and looking for new correlations at the tumor-host interface. Also, I mentioned here a very recent development, which is that the Finnish government started a new large doctoral training pilot, and because of this we have now an opportunity to train a new generation of healthcare professionals in precision cancer medicine with a huge 40 million euro investment. And this is, I think that this was largely because we had the National Cancer Center. Looking ahead, the FICAN has now been mandated to take a responsibility of generating a Finnish cancer strategy, and this is a one-year project, so we are pretty busy on this. This is something that has been delayed for a long time in Finland, and I think that this is again one of the benefits of having a national program, that we actually managed to convince the government that this is needed. We are also, as part of the ECOS project, setting up a National Cancer Mission Hub Finland, where I think it's important to look at the stakeholders which are currently not on board in the Finnish Cancer Center. Namely, for instance, the Finnish Cancer Registry is not currently involved, and also comparing to, for instance, the Danish model, we don't yet have the third sector, the societies and funders as stakeholders. We are also started already a quality register for cancer, as mentioned several times. Having data from comparable data across centers is a kind of a key to be able to compare outcomes and improve cancer care and research. And finally, as you heard, we are applying for a network membership now, and thereby, of course, hope to contribute to the OSCI network development, and of course, hopefully, somewhere in the horizon, we would also have accreditation on our mind. At the same time, it's useful to note that Finland is a small country, and there's been lots of discussion, for instance, in the Nordics, of looking at common kind of network activities. So with this, important to acknowledge the people who are behind FICAN. So we have 5 or 6 directors, myself included, all of whom are participating at the meeting. So thanks for all of you guys for helping, and then the steering group is represented by the different members, and of course also including Johanna Mattsson chairing the meeting. Thank you very much.
Tomi, thank you very much indeed. So we've had examples then of a national cancer network, 5 million, and an example of a regional cancer network covering a population of 2 million. Really interesting to see the similarities, but also the differences between those two. You, of course, because you're national, are far more involved in the European projects, as you said, you mentioned ECOS and lots of the other European projects, which are probably less accessible, at a regional level. But really interesting to hear the different results. Thanks so much, Tomi.
Thank you.